And welcome back. Right now, 9:14. Well, roughly 27 million people in the United States have osteoarthritis, a condition that's especially prevalent in people ages 65 and older. Now, in honor of Bone and Joint Action Week, Dr. Brent Wallis from People's Health joins us now to bring us awareness to this condition. And first of all, let's talk about, doctor, the difference between osteoarthritis and just arthritis. What's the difference?
Sure. So arthritis is really just a general term that we use. It encompasses a lot of different joint-based diseases. Osteoarthritis specifically refers to a type of arthritis that affects the cartilage in your joints. And that cartilage is necessary to make sure that you've got a cushion so that your joints move smoothly with no pain.
So what causes this? I mean, as people age, I know as you get older, the body breaks down a little bit, cartilage may break down, but why do some people, as they age, get it worse than others?
Yeah, I mean, there are a lot of risk factors that you can't really do much about. Age, like you said, is really one of the biggest ones. So chronic use of your joints can result in small damage to the cartilage that then results in inflammation that causes further breakdown. Another situation, though, is people who use their joints a whole lot. So people who participate in sports or maybe high impact activities, things like jogging or snow skiing, that chronic trauma to that joint area can accelerate some of the arthritis from happening.
So a lot of times people say, well, if you do the exercise and you do jog and you do all these things, it's good for your health, but not so much for bones and cartilage, I guess, right?
Yeah, it definitely can have some adverse effects. So you want to kind of look and see, do you have a family history of osteoarthritis? It definitely runs in families, so you may be at a higher risk. So you may want to shift from those higher impact activities to something a little less impact. So maybe walking or swimming. But exercise is critical. You don't want to stop exercising. That helps keep your joints lubricated and prevents a lot of the pain associated with arthritis.
All right, so somebody who is getting older and they're starting to feel a little joint pain and, it's not too bad yet, but it's got the possibility of becoming a really major problem. Is there anything people can do to prevent it? If it's diagnosed early, I mean, like a lot of different diseases, early diagnosis is the best way to really help the situation, if not get better, keep it stable. Can you do that with this?
Yeah, definitely. So one of the most important things by far is watching your weight. So that people that are overweight increase the amount of pressure that they're putting on their joints, in particular their hips and their knees. And so if you maintain a good weight, you're going to put less pressure on those joints and ultimately have less of a risk of developing arthritis. And then, like I said, exercise can be very beneficial. Low impact exercises really help to keep your joints healthy and can help control your weight as well.
I think the key is, you said, low impact. I mean, you're right. We need, for heart health and, for the overall health of our bodies, we need that. But also, the joints need to be kind of, worked as well. But that high impact, I mean, hard running on a hard surface, jogging and, putting all that pressure on all those joints, that could be an issue. So if you do have that, say, coming on with arthritis or osteoarthritis, it may be a good idea to maybe get on an elliptical or something that's really not going to hit those joints so hard.
Yeah, and that's a great idea. Actually, that smooth movement actually will help you exercise the joints, but not cause all of that chronic trauma. And if you are having difficulty with your joints, you're noticing little tweaks or twinges or something like that, you want to speak to your doctor because there can be other treatments that can be done. There are medications that we use on occasion and other therapies that we can do that really can help.
All right. Well, thank you very much. And again, keep doing the exercise. But if you feel the pain, you probably should listen to your body, maybe go see the doctor and just kind of slow it down a little bit so you don't do further damage.
Good advice, definitely.
All right. Doctor, thank you very much. And we appreciate the time.
Thanks, Bruce.